Namaskar. 2019, the last of the teens in this century, it's actually pushed us into the new decade, quite a big of a challenge to do. The world coronavirus, or COVID, will resonate so long and so many years amongst us. The people in this generation will definitely remember this. Well, the entire world is under the grip of pain, fear, anxiety, and uncertainty. It's not the end of the world. We all know. The healthcare workers, government administration, all departments, especially police, across the world, they have gone beyond the call of the duty by putting themselves at risk, saving the lives of the people. And their effort and sacrifices will be remembered forever. We are seeing it every day in the newspaper, how the healthcare workers are at risk, different parts of it. How they are having sleepless nights, spending their time in the hospitals without going to their own homes. This is commendable. The entire world is locked down. There are a bunch of folks from the essential services, such as sanitation, electricity, water supplies, food and groceries, fruits and vegetable supplies, NGOs, volunteers. They're all out there on the streets, daring themselves against the adversities to ensure that we live comfortably during this lockdown. While many industries are either shut down or slowed down, there is one industry that has gone beyond the top gear to service the population across the world, quietly and quite effectively. No points for guessing it right, friends. It's nothing but the technology industry has come to the rescue. In a span of 2 weeks, the whole world locked into a new work mode. And they're able to provide the business continuity to day-to-day affairs across the world. Multiple industries, multiple organizations running with the help of this technology. The world changed so quickly. The business models, they changed. Delivery models remodeled. And all this was possible due to the tech industry quickly reconfiguring how the services are. Let's take a look at some of the significant and noteworthy contributions. There's one which stands out, most important, most significant. It's the way the data is consumed by the population. That's because changed. The broadband and telecom providers responded so quickly to the sudden shift in data consumption patterns across the geographies. The home broadband usage suddenly increased. It's not just the usage for the normal day-to-day office affairs, but people started logging into it for content, movies, music, a lot more. Simultaneously, the consumption of data is slowly spread from cities to the towns because people migrated during the lockdown period, just before the lockdown period, going to their hometowns, trying to work from them. Sometimes even moving to the villages where there is internet connectivity. So it all needed a big shift in the load distribution and the way the data is offered through multiple towers. The industry responded pretty well, and some of the organizations have released the restrictions on the uses of their video conferencing facilities and offering better connectivity and accommodating more people in these conferences. A lot many things. I think we should give kudos to this industry, which really helped us to be connected in these different times. NASSCOM very early predicted the potential impact on the service delivery. It was instrumental in bringing the IT and IT-enabled sector into essential services and also worked extensively with tech industry leaders, initiating the broad guidelines on how to work from home. And it also worked closely with the government in lifting certain restrictions on work from home. This resulted in the industry sustaining adequate service delivery to its clients across the globe. Currently, 90% of the IT workforce is working from home. The tech industry not only adapted itself very well, but did it very quickly. The BPO industry think tank is already converging on the drawing board to rewrite the BPO industry's the core components, how it has to work going into the future. Probably they'll be moving into business process automation industry using robotic process automation technologies. We never know. Let's wait and watch. And I'm sure there are good times ahead for the industry and its employees. No doubt there will be a few challenges faced by the BPO industry, but I think they will come out victorious. Coming to the pandemic coronavirus, the administration is focusing its energies entirely on all these days. They left out every other element. The lives of the people is very important. And the whole administration is working towards how do we deal with it? How do we ensure this virus is not spread? And how do you contain it? How do you treat people? There are 5 dimensions in which the technology is actually coming into play. 4 of them which are already happening, and 1 of them which is likely to be impacted in the future way react to the calming down of this virus, getting out of this lockdown. Let me first talk about the containment part of it. The containment part includes the awareness, early warning systems for people to avoid places where suspected and susceptible cases are residing. Also monitor these people jumping the confinement. Many companies very quickly developed the apps and dashboards using the data provided on the internet, on the social media, which is available on public space. And in some places, even the government provided a lot of data. In fact, multiple government departments picked up this as a major topic and major top priority item, started working with technology organizations to flatten the curve. The Arogya Setu app, launched official by Government of India, actually has come up in record 3 weeks in collaboration with the tech companies. Just want to make sure the disease is not spread. People are aware how to avoid the places which are at risk. So the containment is one which is very, very important, and technology really helped. The second one is about detection. The early detection of likely suspected subject, isolating them, confining them to arrest for the spread of disease is another important dimension which we have to look into. In a country like India, it's not an easy task. It's like looking for a needle in the haystack for a person who might be having a suspicious virus in their body without even their knowledge. Individual screenings is impossible, it takes time, and there's not enough workforce to do the same. Again, the tech industry folks across the country readjusted their products and services portfolios, reinvented some new techniques and new methods to do mass screening at crowded places. This is basically to quickly isolate the suspected cases and carry out further tests, further confirmatory tests. Even with the lack of adequate test kits, there are methods to really find out who could be requiring a potential test kit. A whole lot of tests can be done even before they move into the medical environment. Some healthcare organizations, some of the big hospital chains, using their IT teams, have introduced some very good 24/7 available self-assessment portals, guidance portals, and also assistance in reaching out to the doctors. Very, very useful. And in case of any suspicion coming out of the individuals, they can do the self-assessment and reach out to the doctor. And then they can be guided to the nearest healthcare facility where COVID screening is done. So the early detection is also in a big way will help us to prevent the spread of COVID disease. The next one is about the preventive measures. So how are we really making sure this virus is not spread? and how can we take care of our own cells by simply following certain steps. But as usual, either we are lethargic or sometimes we forget, but somebody keeps reminding us that you guys have to take care of yourself. So the technology has really helped us in a very, very simple things, in either office rooms or washrooms. The solution, very, very simple solutions like a mirror-based IoT devices monitoring how the hand washing is done effectively and preventing people leaving the room without washing their hands properly. There are robots introduced for disinfecting and sanitizing the healthcare facilities, either in the public facilities or in the office spaces or in the hospitals, ICUs, common corridors. This is really useful without the human intervention. There are distribution of food, medication, and other supplies happening using the robots to the patients in the wards. All this is not only avoiding the human exposure to the infected areas or infected patients, but very, very importantly, adding additional capacity to the already thinly stretched medical capacities. Though it comes under containment category, there are also some solutions which actually are doing a geofencing of quarantined individuals and alerting the officials if they violate the quarantine. Let's move on to the treatment mechanisms. That's the fourth dimension which I want to talk about. We all know that there's no vaccine yet to cure the coronavirus. But there are possible areas where we can delay and increase the resistance of the patients, early detection of the patient's conditions and taking adequate care so that the virus is mitigated before it actually gets into the lungs. Effective monitoring and alternative treatment methods are required to save the lives of the patients. It includes automatic monitoring of the patients and the patient's vital parameters, and alerting the medical staff to patients' needs and patients who need immediate attention. One more thing which happened due to this virus spread is the experienced doctors, senior doctors who cross a certain age limit. Some of them are not physically available because of the possible risk factors to them. But using the telemedicine platform, companies have come to the rescue of the situations, many companies. The on-duty doctors have provided continuous guidance, support using this system. Some of the medtech companies also started working on makeshift remote ICUs to enable the critical care capabilities and capacities. So the doctors are available, the doctors spread across the geographies are able to help each other in these difficult times using technology. Let me talk about the fifth dimension. It's about the recovery process. I'm not talking about the patient's recovery process, how the vaccines are invented, administered, and how this disease is dying. It takes some time before this pandemic will settle. But when the world is really coming back to normalcy from lockdown, and it's not an easy process, and people are not going to suddenly shift back in time and business as usual. They'll be very, 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 very careful in getting back to normalcy. Governments, industry, entrepreneurs, innovators, general public, care professionals, researchers, they all will be very carefully looking at how do we get back to normalcy. The process of getting back to normalcy is not so simple, it's a bit complicated. Technology has to play a significant role in this recovery process and prepare the world to address the potential future pandemic. As Bill Gates in one of the TED shows, TED Talks, rightly brought to the awareness of the general public about how the countries will have to plan for the pandemic situations. I think it's the surveillance, prevention, disaster recovery management, the service delivery models, Many of these things will have to take it into consideration, especially when we are really taking care of the future. And it's really driven by the as tech-assisted decisions. So technology is going to play a very big role in how we're going to live our future after this pandemic situation. Before I sign off, I want to remind a famous quote. I'm not able to recall who is the author of this, but it's very, very nice. It says, "Don't waste opportunities thrown open by adversities." The government decision-making speed was lightning fast in the recent past. They have taken bold and wise decisions. Drug discovery process shortened dramatically. Regulatory support for clinical trials was very commendable. The medtech inventions around testing kits, and biggest winner is the deployment of the telemedicine. So people have taken the right opportunity to bring in much needed reforms, much needed comfort, relief to the population from this adverse times. I think the world is going to really follow this model. Let's work towards a better world. Thank you and namaste.